Now, when you're getting into dizziness, some of these things are a little bit more subtle. This is the sensation that you're off balance or you're not quite right with your environment. And these are generally triggered by the visual system, or they can be triggered by the neck and dysfunction in some of the proprioceptive inputs within the neck. So the visual system, you can have visual motion sensitivity, extremely common following concussion injury, where patients feel okay, but when they're in a crowded shopping environment and all the people moving around them, or if they're walking up and down the aisles at the supermarkets and they're seeing all this stimulation coming from their peripheral visual fields, they'll feel dizzy with that. So that's a visual motion sensitivity. Riding in cars, trains, whatever mode of transportation, the visual stimulation of things passing in the periphery can create this visual motion sensitivity. So this could be a visual issue. You also can have convergence excess, where your eyes tend to cross early, and so you're not seeing things at the right point. You're getting a little bit of double vision. That can make you feel off. You can also have convergence insufficiency, where your eyes are drifting outwards and not able to converge appropriately on a target. Again, can cause a little bit of double vision and not able to really feel right with your environment. So those are generally seen and treated by a concussion therapist, somebody who specializes in concussion rehabilitation, or a vision therapist, specifically like an optometrist who specializes in neurooptometry and doing rehabilitation exercises for the oculomotor system, so how the eyes work together. But they can also do some visual exams to make sure it's not something wrong with the eyes or the visual fields themselves. So they can be visual. And the other thing that we've also talked about in recent podcasts is the proprioceptive inputs from your neck. So all of this stuff, your entire vestibular system and how you feel in space, dizziness and vertigo, is related to these three systems. So it's either something wrong with the vestibular apparatus itself or the nerve that connects to it, or it's something wrong with the cerebellum, like a stroke, or it is the vision or the neck. These three systems all tie into the cerebellum itself. So all three systems have to be giving you the same information. If the information is the same, like when I turn my head to the right, for example, my eyes go to the right, my neck tells my brain that yes, we're turning right. The vestibular apparatus tells my brain also that yes, we're turning right. All three of those systems are congruent. They go through the cerebellum, and I feel okay. I'm able to coordinate that motion. I'm able to turn that direction, and I don't feel dizzy when I do that. Now, if my neck is tight in certain areas, the signals that are coming from the spindles and the Golgi tendon organs, which are located in the muscles and joints throughout your body and have the highest density in your fingers and in your neck, so there's the most density of these receptors within your neck. If I turn like this and I have some tightness or I have some joint restrictions here or something where it's not moving quite right, the signals to my brain are going to be altered. And that alteration in signal is going to affect my eye motion, and it may affect the signals that my ears are giving too, where when I turn, all of a sudden I feel, whoa, like I feel really off when I turn to the right. Or people will experience this when they're driving and they're shoulder checking in their car. Or again, they're at the supermarket. Is this a visual motion sensitivity, or is this a neck issue? Because when I turn side to side to look at the shelves, I feel dizzy. Or when I see all the people around and I'm looking at all the people, I feel dizzy with that. So oftentimes it's very difficult to figure out, is this a vision issue? Is this a cerebellar issue? Is this a vestibular issue? Is this a neck issue? And you need somebody who knows all of them. So this is why I recommend going to a concussion-trained therapist specifically. Don't just go to a vestibular therapist. Go to a concussion-trained therapist that's going to look at all these different fields together and how they kind of tie into each other. So that is it for dizziness and vertigo. If you're a therapist that wants to learn how to tie these things in together, you can always check out our Practitioner Education Certification course. It's a 35-hour online course that gives you all the tools that you need to effectively manage concussion patients. You can check that out at CompleteConcussions.com. For those of you looking for care, go to CompleteConcussions.com, find a trained therapist in your area, and they can help you out with any of these problems that you may have.